Today, as a continuation of the bone tumor, in the malignant type of bone tumors, we are going to see the fourth type, which is called giant cell tumor. Giant cell tumor also one of the common type and most important type of benign tumors because this is more challenging clinically and physiotherapeutically to treat because this particular tumor sometimes acts like a malignant tumor because benign tumor usually when you remove it surgically it will not reoccur, but whereas coming to the giant cell tumor, when we remove this still it reoccurs for 10% of the people. That's why it is more challenging. Okay, coming to this particular type of tumor, it happens this also happens at the cartilage part, epiphyseal growth plate area, the ends of the bones where there is a joint articulation takes place, and as a result of that, most often this particular tumor interferes with the joint function. Okay, very commonly this particular tumor occurs at the lower end of the femur and upper end of the tibia when it comes to lower limb. When it comes to upper limb, it occurs very commonly at the upper end of humerus and lower end of radius. Very peculiar feature it has got like this. The reason why it exactly happens very commonly on those region is these are the areas of these long bones. They particularly connected with bone growth. The most of the bone growth takes place at this area for these bones. For femur, the bone growth mostly happens at the lower end. For the tibia, at the upper end. Humerus upper end, radius lower end. That's the reason why wherever there is a more bone growth, that is the area where the giant cell tumor occurs. Okay, how it occurs? The bone, there is a gradual, initially there will be a gradual bone substance loss will be taking place, and those bone substance loss will be replaced by new bone growth, and that new bone growth will happen just below the periosteum, and it will expand the end of the bone, and this expansion will disturb the trabecular system there. Okay, and the bone will become very brittle and will subject the bone for pathological fracture in the future, becomes very weaker. Though it expands, it becomes weaker, and sometimes the expansion go up to the joint surface also and interfere with the joint function. So coming to the clinical feature, most often the patient will have a rounded projections, elevations, irregular portions of the around the joints, around the knee joints and ankle joints, shoulder joint, wrist joint. It can occur at any joints, and along with that there will be a marked amount of pain, and also when you touch there will be tenderness. So these are the clinical features, and not only that, sometimes the patient bone growth also may be affected because it is occurring at the end of the bones, affects the bone growth plate. Okay, and the classical feature compared to other bone tumor, when you compare this giant cell tumor, is giant cell tumor bone growth will occur at the end of the bone. It will expand the bone rather than outside. You will not see any extra bone growth. It is the expansion of the end of the bone is a classical feature of this particular bone tumor. And coming to treatment is basically very deliberately decided based on the necessity, because as I already told you, even if the bone tumor is removed, out of 10% of the cases it reoccurs, and also not only that, it also weakens the bone, and it ultimately leads into amputation in those cases. That's why there's a risk of always losing the limb. So that is why very delicately and very careful scrutiny we have to decide whether the problem should be taken for surgical or not, surgical treatment or conservatively. If the bone tumor occurs at the bones which are not really important, for example they are not weight bearing or they are not very functional, for example clavicle or fibula, in those cases the bone may be completely removed. in order to eradicate the bone tumor. Suppose if it occurs a main bone like femur or tibia, that is the reason where, that is the area where surgical treatment is very carefully indicated. Suppose if surgical treatment is indicated, the excision of the tumor should be complete. If it is any small portion is left alone, that will become a metastatic tumor in future. That's a problem there. So complete excision is very important. Suppose if it involves joint region, then what they will do, remove the complete tumor and the joints will be sometimes sacrificed. That means it will be fused in order to make the limb useful. Otherwise it will go to amputation. So that is a risks and challenges associated with this giant cell tumor. And some people are very much advantaged with radiotherapy for this giant cell tumor. However, when they take giant cell therapy for few years, the tumor subsides, but in the future it becomes a malignant tumor. So there is a risk also. So whether it's a surgical or radiotherapy or conservative, there is always a risk associated with this particular tumor type. Okay, so that's all about the giant cell tumor, and we will see the malignant tumors in the future. Next class onwards, we'll see the malignant tumors, how they are classically, featured differently from the benign tumors, and how they are clinically, physiotherapeutically challenging for us. So all those things we'll see tomorrow, I mean in the later classes. Thank you very much. See you all. Have a nice day.